Good evening, everyone, and welcome to our annual survivorship event. My name is Nancy Lean, and I'm the director of the Oncology program here at Torrance Memorial. I've been here for 9 years, and it is my honor and pleasure to serve as your moderator for this wonderful event tonight. So welcome, and we're very excited to get going. Tonight's program, we're really excited to have the Dempsey Center, an integrative center from Portland, Maine. They are leaders in quality of life for individuals and families impacted with cancer. They will be talking about various integrative modalities to help promote wellness and relaxation, especially given the last couple of years that we've experienced with COVID. Stress seems to be the norm, and I think any help we can get in managing that will be most helpful. This is our 30th survivorship anniversary event, and Miriam Slevins, our survivorship coordinator, a cancer survivor herself, has hosted the last 9 wonderful events, each one getting better every year. On a personal note, this survivorship celebration is especially meaningful for me, as I'm a cancer survivor myself, having been diagnosed last year with breast cancer. So I am very grateful to be here with you all tonight to celebrate cancer survivorship. I did want to take a moment, a little bit of a moment, to acknowledge and thank all of the doctors, the nurses, the healthcare professionals who've dedicated their professional lives to supporting cancer care and promoting cancer science. Because of all of their years of dedication and support, we've seen great advances in cancer care and outcomes. When I did some research on this, it was very comforting to know there are 17 million cancer survivors. That represents 5% of the population. And by 2030, that number will go to over 31. And that's of the US population. So we are here tonight to celebrate all of the cancer survivors. And we hope that you enjoy this special event that will help us in the future. So with that, I would like to take this opportunity to introduce Dr. Hugo Houle, our medical director of the Hunt Cancer Institute, who will give you a little bit of an overview of the Hunt Cancer Institute here and all of the services we have to offer our cancer patients.
Thank you very much. I'll restart. Again, I would like to thank Nancy Lean for that introduction, and also echo the gratitude we have to all the supporting staff that help us bring great cancer care to our patients. The Hunt Cancer Institute is a broad institute that is devised of a multidisciplinary team of physicians. It was founded several years back in collaboration with Torrance Memorial Medical Center. And it brings together oncologists, radiation oncologists, surgical oncologists, specialists in GI, thoracic surgery, gastroenterology. We also have pulmonologists, dermatologists, pathology. We also have rheumatology, and all these multidisciplinary physicians come together to help our patients bring the best cancer care we can right to them where they live. The Hunt Cancer Center broke ground about 3.5 years ago, and we opened the center in December of 2019. And it's a beautiful center bringing state-of-the-art care to our community. You know, right after we broke ground and opened up the center, of course, COVID-19 pandemic was, presented itself to us. Yet we kept the doors open, and that really is a testament to our staff and the fortitude of the people that work at the Hunt Cancer Institute and Center. We also have nurse navigation in our center, which allows us to help our patients throughout the cancer journey. We have prehab and rehab. So prehab is where we have physical therapy that starts before treatment and gets people prepared for the treatment regimens, and sometimes surgery and sometimes radiation. So we have a lot of things we bring to our patients. Part of it is also what we'll be talking about today is all the support and ancillary and integrative therapies we bring. So we're really happy about where we are today, but we want to always continue to move forward with our patients and, of course, the people around us. Thank you for allowing us to come into your living rooms, and thank you for joining us.
Thank you, Dr. Houle. And we are very proud of our Hunt Cancer Institute here at Torrance Memorial, and we thank you for all of your leadership and vision over the years. Thank you. Next, just to add to some of the things that the Hunt Cancer Institute has really been focused on over the past couple of years is integrative medicine. And we currently have a part-time therapist on board with us who has been teaching all of the staff, the nurses, on how to do some of these therapies. We do essential oils, yoga, breath awareness, Reiki. We have mental health resources and nutrition. These integrative therapies are becoming more and more important to cancer patients and their families as life gets more stressful. So I wanted to also give you this resource. For more information about our integrative therapy programs, you can see our website. It's very detailed and informative. So next on our agenda, we have a video presentation from the Dempsey Center on various integrative therapies and modalities that help support wellness and health for cancer patients. Now, you're probably wondering, how did we partner with the Dempsey Center all the way in Portland, Maine, as we sit here in Torrance, California? Well, I'll tell you a little bit about how this relationship came about. In 2019, several of us from the Cancer Center here attended an American Cancer Society Spirit event that was honoring Patrick Dempsey for all of his support of the American Cancer Society and all cancer patients. Patrick Dempsey, for those who might not know, played Stephen Shepard in Grey's Anatomy, a very popular TV show that started in 2005 and ran for 18 seasons and can still be watched on TV today. So we met him at the Spirit event, and we were pretty excited about that. We were even really more excited when we actually got to meet him and talk to him in person. So he told us about how he grew up in Portland, Maine, how his mom's first cancer treatment was done in Portland, Maine in 1997, and how he wanted to give back to his community. And so he started the Dempsey Center in 2008, where cancer patients can go to receive integrative therapies at no cost. So this year, when Miriam and her committee began planning what type of event that we could do virtually, and looking at all of the stress that people have gone through over the past 2 years, which has been crazy, we thought that integrative therapy would be an ideal topic for our event. And so we thought, well, let's reach out to the Dempsey Center and see if they would partner with us, since they've been doing this for so long and might have some innovative ideas and approaches. So we did reach out to them, and here we are tonight. They'll be coming to you via video from Portland, and then their therapists will be available to answer your questions in person. And yes, we really appreciate them staying up so late because they're 3 hours ahead of us. So it's about 9 o'clock over there. So we really do appreciate their support and their partnership. And we hope this is a long lasting relationship because we're all very, very committed to integrative therapy as an addition to all of the care that we cancer patients need. So be sure to put your questions in the chat box. I'm sure you become familiar with that over time. And without further delays, we will turn over the program to the Dempsey Center, beginning with Trish Caldwell and movement therapy.
My name is Trish Caldwell. I'm the Movement and Fitness Coordinator at the Dempsey Center. I'm a registered nurse, and I have certifications in oncology, yoga, and exercise. Some movement and fitness programs that we offer at the Dempsey Center, education, classes, workshops. Specifically, we provide yoga classes, Tai Chi, functional fitness classes. We always offer a form of a chair movement class in our offerings. We also offer specific workshops, specific to meet the needs of a cancer diagnosis. For instance, yoga for stress reduction, yoga for better sleep. So throughout the quarter, we offer a variety of different programming, but our core classes are yoga and Tai Chi. So classes at the Dempsey Center are specifically designed to meet the needs of the cancer diagnosis during and post-treatment. So any classes that are provided are really looking at the potential side effects that could happen because of treatment. So classes have an intentional movement throughout the class. So it really is specifically designed to meet the cancer diagnosis. So in addition to our group movement and fitness classes, we also offer one-on-one fitness consults. So we actually meet with a client one-on-one, sometimes a client and their care partner, and we really, really hone in on their individual needs, and many times offering resources both within the center and outside of the center. What you'll find with classes is that they do meet a diverse group, whether they're pre-treatment, post-treatment, during treatment. And our clients really give us the feedback that they experience the intentions of the class, well-being. They feel better. They get better sleep. They don't feel as tired. They feel stronger. Their flexibility is better. So many of the things that they're experiencing because of the side effects, because of their treatments, both during and after their treatments, we're really hearing back from our clients that these forms of exercise are really, truly giving them those benefits. That's one of the reasons why we chose these classes, yoga and Tai Chi, because there's so much out there studies showing that these really are providing those benefits. With cancer survivors, and again, studies show that, there's many times with movement and fitness, with exercise, that, it does reduce the risk of recurrence. And our cancer survivors coming in are experiencing the same benefits. They may have fatigue. They may not feel well. Kind of brings them back into community, into a group that has experienced the same thing that they've experienced. So cancer survivors, we have many cancer survivors who actually are years away from their diagnosis and aren't experiencing symptoms, signs, side effects from their treatment, but in turn, they're receiving the benefits of these classes. And I think the beauty of the Dempsey Center, too, is when we talk about, how we work as a team of services, when we see our clients, they come in as an individual and we truly meet them where they are. And whether they choose to do one service, they will get the benefit of that service. Or if they choose a variety of services that we offer, there's that cumulative effect of all of the benefits that the services of the center can provide. Many times I will get referrals from the nutrition program because nutrition and exercise seem to many times walk hand in hand. So I will get a lot of referrals from our nutrition, our registered dietitians. Many times I get referrals from our massage therapists because, again, we're talking about physical things that are happening, and many times a movement and fitness class can actually help with some joint mobility, range of motion. So oftentimes we're referring back and forth to each other. And again, you see the cumulative effect of the work that we do.
Hi, my name is Judy Donnelly. I'm a registered dietitian and the program manager here at the Dempsey Center. I'm also a member of the Oncology Dietetic Practice Group as part of the Academy of Nutrition and Dietetics. So we offer a variety of programs and services for people who are interested in nutrition at the Dempsey Center. Some of the programs that we offer are really geared towards people who are in cancer treatment at the time and are experiencing, it's common for people to experience a lot of side effects to their treatment that really have a pretty serious impact on their ability to maintain their nutrition. So anything that affects the GI tract, sore mouth, taste bud changes, we offer some classes and one-on-one consultations that help people to address those problems and provide tips and support to help them up their nutrition. We get a lot of feedback from the clients that we work with, and what we hear a lot from people who have been through the nutrition program is that it helps them to weed through all the information about nutrition that they might get online. There's a lot of good nutrition information out there, but there's a lot of information that, really isn't evidence-based and can make people be a little bit confused about what the right food is to eat. So in our classes, people really come away with some good, solid guidelines about, how to eat well. And every once in a while, we have groups of people who really want to shift their diet in a way that's a little bit more plant-based or even vegan. And those are very healthy ways to eat, but they can be a little bit tricky in terms of making sure that you get all the nutrients that you need. So we offer a program called Making the Move to a Plant-Based Diet that really gives people the toolbox that they need to ensure that they're eating the right foods that are going to help them get all the nutrients that they need as part of that diet. So certainly during treatment, nutrition is quite critical. People oftentimes experience low energy, just fatigue throughout the day. And some people experience a lot of weight loss during treatment. And so nutrition becomes really important during those times, just so people are getting the nutrients that they need so that their body is functioning at its best. But also, if people are losing weight, they run the risk of missing some of their treatments. And so by making sure that people are taking in what they need to maintain their nutrition, we can potentially eliminate mistreatments. And then moving forward, what we try to do in our survivorship nutrition programming is give people the tools that they need to make sure that they're getting all the nutrition that's required, not only to reduce their risk of cancer, but to also reduce their risk of heart disease, reduce their risk of becoming overweight, help them to lose weight if they need to lose weight. And all of those things are going to improve their overall feeling of well-being. Our staff collaborates on a lot of different levels, certainly with nutrition when people are in treatment and they're having a hard time with maybe a dry mouth because they've had radiation to their oral cavity or their throat. They're not producing a lot of saliva, and that really makes it difficult for them to eat. And so I'm so grateful to have acupuncture as another resource here at the center, because acupuncture has been shown to help improve salivary flow for people who struggle with that problem. So it's really great to be here on staff, but have these other disciplines really at our fingertips.
So my name is Kaylee Sullivan. I'm a licensed clinical social worker and a certified oncology social worker. So here at the Dempsey Center, we offer oncology-specific counseling services for clients, really for anybody impacted by cancer. So someone who has been diagnosed with cancer themselves, any of their loved ones. We also offer bereavement counseling for people who've lost a loved one to cancer. And then we have support groups, which range from groups for people who are maybe newly diagnosed, groups for women, groups for men, groups for people with advanced cancer. And then we also offer bereavement support in a group setting as well. So addressing the psychosocial and emotional needs of people who have been impacted by cancer is really vital to helping promote positive outcomes with treatment and helping people cope with their diagnosis and cancer experience. So many people come to us with various emotional concerns, right? So things like loss of control and independence in their life, shifts in roles that cancer may have caused, and then people often who are transitioning maybe out of active treatment often come to us with a fear of recurrence, kind of general anxiety or maybe symptoms of depression as a result of their cancer experience. So that's really what we're hoping to make a difference in by offering cancer-specific oncology counseling. So oftentimes clients will bring in issues like fear of recurrence. Maybe they're struggling with shifts in their roles at home or changes that they've been kind of forced to accept as a result of their cancer experience. We certainly also work with people around grief and loss, whether that means loss of a loved one and kind of grieving that type of loss, or loss related to things in their life that cancer has maybe made more difficult for them or taken away. So, we're really fortunate here at the Dempsey Center that we work as an interdisciplinary team, and we're able to kind of help each other and help clients really with this wraparound package of services. Oftentimes clients describe to us feeling kind of isolated by their cancer experience, and that's a very common experience. And the center really has done a lot to promote community amongst people impacted by cancer. So, for instance, we have support groups that we offer both virtually and in person for people who want to connect with others who are experiencing a similar cancer impact. And I think that extends to our other service offerings as well. I think about movement and fitness classes where people are kind of in a communal space, either online or in person, and moving together, or nutrition workshops and classes where people may be all, again, gathering together to learn a new recipe, to talk about some of their concerns regarding their nutrition. It's just a wonderful way to help people feel connected and validated and bring people together.
My name is Sarah Walter, and I am the Healing Tree Manager at the Dempsey Center and an oncology social worker. So Dempsey Center's Healing Tree program is more than a collection of services. It is a youth-focused, family-centered model of care based upon an understanding that well-supported children are an integral part of health, hope, and healing for all involved. Healing Tree services deliver benefits to not just the children and youth and families that come through the door, but to really the whole family system, because it reduces stress for children and for their parents and caregivers and increases resilience. We know that this work is important because 1 in 4 adults diagnosed with cancer in the United States is the parent or caregiver to a child under the age of 18, which means there are at least 3 million children in the United States who have a parent who is currently coping with a cancer diagnosis. Parents and caregivers often experience more emotional distress and physical challenges during cancer treatment because of their caregiving responsibilities, and often it can lead to more interruptions in treatment or delays in care for parents who are also facing a cancer diagnosis and treatment. So what parents always want to know, and one of their biggest sources of stress, is, are my children going to be all right? And how is this going to change their lives and impact them? And so the Healing Tree allows us to help reduce stress and provide additional support to children and youth and families, which also then reduces the stress on the entire family system. And it can build resilience. It offers emotional support. Our services offer emotional support to children in the form of individual counseling as well as family counseling, typically for children between the ages of 5 and 24. We also offer complementary therapies to children, such as massage and Reiki services, which is really helpful for children who are going through cancer treatment or to manage stress and help with things like sleep and helping families manage stress through eating a healthier diet with our nutrition services, things like that. One of the most important components of Healing Tree is that we offer opportunities for connection play and adventure. And we know that play and having fun and not just talking about or focusing on cancer when children and families come into the Dempsey Center and the Healing Tree program is so important, because children communicate through play, and that's how they process their feelings and emotions. So it's very important that that's a key part of our programming. It's not just the business of medical care. It's about giving them the opportunities to connect in meaningful ways and learn coping skills that they can use in our office, but then also take home with them at the end of the day. We know that the emotional impact of a cancer diagnosis does not end for parents, caregivers, and youth when the cancer treatment ends. And so offering counseling and emotional support services to children and families even up to 2, 3, 4 years post-diagnosis is important, because when a family or a child or a parent is in survival mode when they're in treatment, they often do not fully cope with the emotional repercussions of the experience they're going through. And it's sometimes cancer treatment can be a traumatic experience, both for parents, caregivers, or children. And so offering emotional support workshops and complementary therapies post-treatment for survivors is really important, because sometimes anxiety and stress and some of the fears that come up for youth don't occur until 6 months to a year, and sometimes longer post-treatment. And that's when, once things have calmed down and they're feeling a little bit safer, they can actually finally verbalize the fact that I'm really worried about mom or dad or my caregiver, dying. And is this going to come back? And are we going to have to do this again? And so it's very important to continue offering care to survivors post-treatment, because families are still dealing with the stress and repercussions of the diagnosis and treatment for months to come.
I'm Maggie Miller, and I am the complementary therapy manager. I'm a board-certified massage therapist. I'm a board-certified structural integrator. I've had specialty training in oncology massage, manual lymphatic drainage massage, and scar tissue rehabilitation. Our complementary therapy services encompass our Reiki program, acupuncture services, and oncology massage therapy. We also offer classes and practice opportunities in meditation and mindfulness. So together and on their own, these different modalities address some of the top concerns that cancer patients may have. That would be things like fatigue, stress, anxiety, pain, nausea, neuropathy, to name a few. Reiki can be a good choice for clients who have some touch sensitivity. It can be very restful for people, and it can be helpful for those who have difficulty sleeping. So there are many ways that we collaborate to address client needs. For example, our nutritionists might recommend dietary changes, but as massage therapists, we can teach clients abdominal massage to help relieve some of those digestive issues as well. Our massage therapists will also collaborate with acupuncturists to be able to teach clients acupressure points that they can use on themselves, or we can incorporate those acupressure points into massage. So acupuncture, massage therapy, or Reiki can be an integral part of a client's cancer journey while they're in active treatment. Those things can also be a really important part of somebody's survivorship. Sometimes when someone is in active treatment, there are so many appointments to attend to. And in survivorship, there's really the opportunity to settle in and create a self-care plan that can sustain. Some clients have said that the discovery of these tools and gifts has been the silver lining in their cancer journey.
So my name is Liz Como, and I'm a massage therapist here at the Dempsey Center. I have training in oncology-specific massage. The sessions that we offer here at the Dempsey Center are, we block off an hour of time, and depending on the client, it's, the actual massage itself is somewhere in the vicinity of about 45 minutes. Part of what we do is we do a pretty extensive intake with our clients to make sure that we're addressing their needs as well as avoiding any contraindications or complications that we don't want to further. If you think about somebody who's undergoing cancer treatment, their nervous system is in a state of heightened alert. So when we're stressed, our sympathetic nervous system, or the part of our nervous system that we call the fight or flight response is often on a heightened sense of alert. Then there's the parasympathetic nervous system, which is the part of the nervous system that helps us to rest and relax. So sympathetic, parasympathetic. And in oncology massage with the client or with the support person, what we're trying to achieve as sort of like an overall goal is we're trying to bring down the sympathetic nervous system response and enhance the parasympathetic rest and relax response. So the massage that we do with oncology clients is different than the type of massage that you often will get when you go to a massage therapist with specific muscle complaints or aches and pains. That's not to say that what we do doesn't necessarily address those aches and pains, but our focus is a little bit different. So it tends to be a more calming, slow, gentle type of massage. We pay attention to things like if there's any challenges on the lymphatic system. We ask them questions about other symptoms that they may be having, because some of the approaches that we can use in massage can address those symptoms both directly or indirectly. So if somebody is having digestive issues, I could work on her feet and address some of what we think of as the reflexology points on their feet, where the client might not necessarily want me to work directly on her abdomen. When people are having specific issues that I might not be able to directly address as a massage therapist because of challenges with the lymphatic system or lymph node removal or recent surgery, I might refer a client to one of our acupuncturists who might be able to more directly address that because of the way acupuncture works with the system. The beauty of massage is that, whether the person is directly undergoing cancer treatment themselves or whether they're supporting the person that's undergoing cancer treatment, we can adjust our treatment modalities as massage therapists to really enhance their strength. What are the things that they need to access to work through their cancer treatment, or what are the things that they need to access as the person who's supporting someone who's going through cancer. That piece of helping to enhance our whole health is so powered up by touch. So every time another person touches you, especially with the intention of peace and calm and healing, you release a hormone called oxytocin. Now, oxytocin is known as the love hormone or the feel-good hormone. When we have that release of oxytocin, that love hormone in our bloodstream, it decreases the stress hormones in our body on a general basis. And so regardless of where somebody is in their cancer scenario, whether it's mid-treatment, end of treatment, or post-treatment, massage is going to be so beneficial for them.
I'm Christy Demarco. I'm a licensed acupuncturist in the state of Maine. I have NCC AOM diplomate status in both acupuncture and Chinese herbal medicine. Taken many oncology continuing education classes in acupuncture, including Memorial Sloan Kettering's Cancer Center Integrative Medicine courses. For acupuncture at the Dempsey Center, we provide it in a community-style setting, which is primarily in chairs, with people coming in about every 15 minutes for their appointment. We access mainly arms, legs, scalp, and ears. For acupuncture to benefit the cancer patient, I think really the main things are quality of life and adherence to treatment. At least that's what I see when I'm treating people here. And the best thing I can do is provide examples. So I have a woman coming in today who's finished her radiation portion of breast cancer treatment, and she was really having some severe hot flashes. And what happens with these patients is sometimes their side effects of the treatment really makes them question whether or not they're going to stick with this particular treatment. And with her, she actually had a morning that she woke up feeling rested, and she had been waking up several times a night with these hot flashes. But also, people will come in just with body aches and pains that they didn't have before, that are a little more noticeable now, and it could be related to treatment or not in a direct way that's obvious. A lot of people will come in with the chemo-induced peripheral neuropathy that hasn't resolved, and so they will get some relief from that. And a lot of people are also dealing with a fear of recurrence, or again, adherence to their treatment protocol, where they've been, they don't actively have cancer, but they're in a prevention kind of treatment. When we talk about something like hot flashes, we often only talk about the women, but there's a lot of men who come in prostate cancer treatment, and they will have hot flashes. And when they come in and they get relief from that symptom, they are just very grateful, remarkably relieved, and again, a better quality of life. In terms of working with the other services at the Dempsey Center, I had somebody come into the clinic recently telling me she was referred by one of our massage therapists. She'd had surgery for breast cancer, and for whatever reason, they had to go back in a second time. And so what she was experiencing was some lymphedema and some pain and some limited range of motion. And she was having PT lymphedema therapy. She had gone to see one of our massage therapists, and I believe what it was is the massage therapist could do lymphedema or lymphatic type of massage, but couldn't really work deeply into the area. And with acupuncture, we have techniques where you can work distal, away from the area, and you can release a shoulder, or in this case, a pec muscle, possibly by a point that's not even anywhere near the area. And that was the case with her. So I was able to test some points and have her do some range of motion right while she was in the chair, and her arm, she had better range of motion by the time she left, and even when she came back 1 week later. And her comment, I think, is probably the most poignant, is that she felt like she was still doing these other things, physical therapy, going to massage, but she just felt like it all was coming together for her. And so that her recovery was making progression, where it might have stalled for a little bit of time, but she felt like adding the acupuncture in conjunction with the other therapies really was helpful.
Well, we're back, leaving Portland, Maine, back to Torrance Memorial. That was an outstanding overview of integrative therapies, a very comprehensive, collaborative, and family-centered program at Dempsey Center. And the therapists were very insightful, knowledgeable, and caring. This was great information for all of us, and we thank you to the therapists who gave of their time and insights for us here today. Thank you all. So now what we're going to do is have the Q&As, and I believe some of you have been busy in the chat room, so that's great. And we're going to go ahead and start. I will read the questions that are being fed to me here, which is great, and then we'll have our experts answer those from the Dempsey Center. Also with us today, we have Dr. Houle here, a medical oncologist, and a medical oncology nurse practitioner, Susan Starr. So between the team that we have here, we hope to get your questions answered. So the first question we have, does the Dempsey Center include cannabis products in your treatments to enhance appetite, pain reduction, and sleep? Does anybody want to take that question?
Well, let me just start. Hi, I'm Maureen Higgins, and I just want to, first of all, thank you for inviting us to participate here. This has been really, really exciting. So the Dempsey Center, we offer support services, but we don't treat cancer. So I just want to clarify that a little bit. So we don't prescribe in that way. We don't have that ability here. Although we do, in fact, on Friday, we have a program coming up, an educational program talking about cannabis and its use, some of the different aspects of that. Maggie might be able to talk a little bit about that. And I just want to mention that we have our 2 physical locations in Maine, and our third site is really our virtual platform, which is Dempsey Connects. And many of the programs that are educational are things that folks can connect to anywhere in the country. So if anybody's interested in that way as well, we certainly work with folks anywhere along the cancer journey, as you've heard, from diagnosis through treatment, survivorship, and beyond, and also for with care partners. So it's anybody impacted by cancer. So I just wanted to mention that as well. But Maggie, you might be able to address a little bit about the cannabis.
Yeah, sure, of course. So if we don't have the expertise on staff, we will reach out to community members. So we are fortunate to have a cannabis expert who's a physician in our community who, like Maureen said, is coming to speak about that and address the questions of our community this Friday. So you can actually look that up on our website because it is open to anyone, as long as you're registered for the program.
Okay, thank you. The next question I have is, can I receive massage therapy if I had lymph nodes removed?
So the answer is yes. Anytime someone comes in to receive massage, we reach out to that person's provider to get a medical eligibility form signed to indicate that it's safe for that person to receive massage. There's a lot of considerations for someone who's had lymph nodes removed in terms of pressure, location, direction of stroking, that type of thing. So we do work with clients with lymph nodes removed. That's one of it's a big part of oncology massage training. So if you are going to get massage in the community, I'd encourage you to look for somebody in your community who has experience working with oncology patients.
Thank you. The next question is, I just finished my cancer treatment. What can I do to take care of myself?
Judy, I'm wondering if you want to address a little bit of that, and then Tish.
Sure. Hi, everybody. I'm Judy Donnelly. I'm the nutrition program manager. And, I would say when people are just finishing treatment, one of the biggest things that we like people to come away with is that things may not return back to normal as quickly as you would like them to. We often find that people struggle with fatigue for long periods of time after treatment, but certainly from a nutrition standpoint, just taking a look at your own diet and doing your best to eat well, get enough protein in your diet. Certainly if you've had surgery, recovery requires some adequate protein, but really looking for good, wholesome foods, eating well throughout the day is going to help with your energy level, and just replenish any nutrients that you might be running short on.
Thank you. We have
Tish,
another.
do you have something that you'd want to add to that?
As far as movement, and just speaking to what Judy was saying is that so many times, again, clients will come in and just what they are experiencing and being able to move again. And that's why we actually call it movement and fitness. The classes that we do are gentle, manageable. And I love it because I'm going to say that Maureen sent me a text and she said, movement is medicine. And she's so right. So just moving again and experiencing, just building that energy back in a real gentle, manageable way.
Thank you. I have another question. I'd like to hear more about your nutritional approach.
Sure. So, with respect to survivorship, and I guess I would assume that that's what the question is referring to, we promote the Mediterranean diet. The Mediterranean diet is also sometimes referred to as a plant-based diet. So I'm just seeing in the chat, vegan, whole foods, plant-based. So Mediterranean diet isn't a vegan diet. Sometimes it's interpreted that way because plant-based is part of the descriptor. But what we know about nutrition is that plant foods bring with them lots of supportive nutrients, anti-inflammatory nutrients, nutrients that boost your immune system, antioxidant nutrients, and all of those really support the body and support tissues and all the different biochemical reactions that occur. You don't necessarily need to be vegan. That's not what we promote, but we promote the base of the diet being predominantly good quality, wholesome plant foods, complemented by the animal foods if you so choose to consume them.
Thank you. Next question coming up is, I find the greatest challenge is educating physicians treating patients with cancer about the benefits of integrative medicine. Can you comment on that? I think it's getting the word out about integrative medicine.
I'll take a stab at that. So part of my role at the Dempsey Center is to go to oncology practices and talk about not just what we do, but why we do it. And I think that part is really important. And so you've heard from some of the speakers through the film what the benefits are. And so really providing that type of education and then being able to give the feedback to the physicians. One of the things that we're doing is also collecting data and giving the feedback to physicians about what the client experience is. And that client experience speaks louder than anything else. And how people benefit from some of these different support services that we offer, whether that be going through counseling or movement and fitness, any of the complementary therapies, et cetera. So a lot of what I do is really educate why we're doing what we're doing, not just what we're doing. And I think that's really beneficial. We do a lot of invitations for healthcare professionals to come in and see us. And be able to have those conversations with some of our providers, and then also to do some educational opportunities for primary care physicians, for oncology professionals, et cetera, so that they, again, are hearing not just what we're doing, but why we're doing it. I don't know if anybody else has something to add to that.
Dr. Houle, would you like to add to that?
Well, from our standpoint, I think we do understand a lot of the benefits of integrative medicine. I think our challenges are reimbursement, the busy schedules of some of the patients, and, the availability of those integrative services. But I think also as we become more comfortable in Western medicine with integrative services and support, I think it will become more natural and more commonly used. I think it really does help the outlook of our patients and their ability to, persevere, or I guess the resilience of our patients.
I'd like to add one thing as well. is there's a committee at Torrance Hospital that's working on multiple different integrative therapies or a way to incorporate it in the hospital in the outpatient setting. And this particular group, as a very generous donor and with the motivation to educate medical staff. So a few months ago, we had an integrative cardiologist from Scripps come up and do it. Actually, I think it was a Zoom hour talk for our physicians and staff, just talking about integrative medicine. So we are working on that here at the hospital in terms of promoting or educating actually the doctors and staffs on integrative medicine.
Thank you. It's interesting. We hear a lot since COVID about resilience and about self-care. Have you noticed that you have an increased number of patients and families coming in since COVID?
Certainly, COVID has been a real challenge. One of the programs that I happen to help facilitate is our Survive and Thrive, which is for folks who are post-treatment, and really dealing with that overlay of COVID has impacted folks in numerous ways. We've heard, of course, nationally and have experienced within the folks that we see the increased needs of mental health that COVID has exacerbated. And I'm wondering, Kaylee, if you wanted to talk a little bit about that, because I know that that's really your area of expertise.
Sure, absolutely. Yeah, I think you're absolutely right, Maureen. I think COVID has definitely exacerbated, mental health issues for many people. I mean, how could it not, right? It's put an extreme amount of stress on the whole world, really. And people impacted by cancer are no exception to that. I think, a lot of the issues that we've been seeing kind of related to COVID with people coming in is this kind of increased sense of isolation. And, as I said in the filmed piece, isolation tends to be a difficult thing for many people with cancer. Even people who are surrounded by loved ones can sometimes still feel lonely within their cancer experience and isolated. And then the kind of need to physically isolate through the pandemic, I think, has been an even bigger challenge for many. So, we've been able to kind of try and meet that need through many of our virtual programs. So we have lots of virtual support group offerings and are just kind of now slowly moving back into in-person. And there is kind of a desire for many to be back in person and to have that sense of kind of community, everybody in the same room. So we're trying our best to kind of meet those needs, but it certainly has been, I think, a challenge to many people's resilience.
Thank you. In some ways, I think COVID has really, helped us to get integrative services out there and putting it in the forefront. Because of the increased demand, people are talking about self-care and resilience. So it's kind of good and bad in a lot of ways. So thank you. Should I talk to my oncologist before I make an appointment for one of these therapies? Dr. Houle?
Yeah, so let me chime in on that. Yeah, absolutely. It's important to have good communication with your treating physician and also your therapist. It's a collaboration, and that's the whole point of all this, is to collaborate about the care and find out what is the best approach to that individual. So there's certain things that may interfere with treatments, may delay treatments, may interact. And we want to avoid those. And then there's other things that may actually potentiate your treatment, make you, again, more resilient or more, I guess, less, have less side effects is the best way to describe it. Feel better after the treatment. Yeah, even though these treatments are, difficult to go through, have lots of side effects. But can we get you through it and feeling the best you can be? And that's where the collaboration with integrative medicine, I think, is where it's an unmet need and a real big opportunity for us.
Any other comments? Okay. The next question we have is, how do I know who is qualified or competent to provide these therapies and who is not?
Well, that's a great question. I think that, and I'm going to sort of let the rest of the panelists address this, but a lot of what it is looking at what somebody's credentials are and what their experience is specifically with oncology patients. So I'm going to sort of then turn this over to Kaylee. Should we start with you?
Sure. Yeah. As Maureen said, you'd want to make sure that your provider is credentialed appropriately, and that will look different depending on the discipline that you're and the service that you're seeking out. For counselors, oncology social work or oncology counseling is a niche. It is a specific kind of professional identity that comes with its own training and certifications. There is an certified oncology social work credential that many of us have. But certainly you'd want to make sure that whoever you're seeking mental health support from has some background or at least a foundational knowledge of working with people impacted by cancer, because there are kind of very specific issues that come up in the context of a cancer impact. So I would recommend just kind of asking questions. And especially when you're seeking out a therapist or a mental health provider or counselor, I always recommend kind of, the first session is they're interviewing you, right, to get some information, but you're also interviewing them to see if it's going to be a good fit. And sometimes it may not be, and you may need to kind of interview a couple different providers to make sure that you feel comfortable. But that's a really important piece. You want to make sure that you're feeling comfortable and that it's easy to build that kind of trusting relationship with any counselor that you're seeking out.
Maggie, would you be able to address specific to oncology massage and acupuncture?
I can address certainly in relation to oncology massage. I thought what Kaylee said was right on, and it actually applies to finding an oncology massage therapist too. The professional organization is the Society for Oncology Massage, and their web address is S4, like the number 4, OM.org. And there's a therapist directory on that site.
Great, thank you. Tish, would you like to talk a little bit about movement and fitness?
Sure. And again, in the movement and fitness world, there are certifications out there. Oncology yoga certifications, American College of Sports Medicine. They have a training specific to cancer exercise specialists. So there's numerous trainings out there in the movement and fitness world. So, looking to someone who does have a background in an oncology exercise is always a good thing to have. And that's, we work with folks that have training and are providing that.
Thank you. And Judy?
Sure. I think in terms of nutrition, it's a good idea to look for someone who is a registered dietitian. And, there are lots of different folks who have the title nutritionist, but they don't have the same background as a registered dietitian, potentially. And the reason that I differentiate the two is that, what I find is that people who come to me with their cancer diagnosis don't just have a cancer diagnosis. They might also have diabetes. They might have blood pressure issues, a whole host of chronic diseases. And so you want to be working with someone that can sort of tease out all the different issues that people might face with their diet and be able to pull it together into, a solid recommendation for that person. So registered dietitian is a place to start. And then within the registered dietitian field, you can also specialize in oncology.
Okay, thank you. We have another question here. How might integrative medicine or relaxation work with chemotherapy?
Maggie, would you like to talk a little bit about that?
Can you repeat that one more time? The question?
How does integrative therapy, relaxation work with chemotherapy?
How does it work with chemotherapy? Well, I think a lot of folks have used the word resilience and comfort and support. So I think that complementary therapy offers clients that. I think in terms of just looking at something like massage, I think going back to finding someone has a specialization in oncology work is critical, because there are some chemotherapy drugs that increase the risk of things like blood clotting. So you would want to find somebody who has an understanding of that, so that there aren't potential risks. So somebody is not, putting themselves at risk when they're in chemotherapy and receiving massage. But if someone can find someone who's trained in that way, it can be hugely supportive and beneficial.
Thank you.
Can I make a comment on that? This is Dr. Houle again. So one of the things we see is that patients become very anxious when they come in for chemotherapy. Of course, it's a new experience for a lot of them. And even when it's more a chronic disease, they still have this anxiety about treatment and what it will entail or cause as far as their symptoms. So some of these support integrative therapies reduce that anxiety before the treatment, therefore allowing them to be more relaxed during the treatment. And many times that leads into less nausea and even vomiting after treatment. Sometimes the anxiety can be so severe that they actually miss appointments because of just the thought of having the interaction. So that's where I find that it's just so invaluable to have this support.
And if I can chime in on that too, we will tell our patients they can bring a weighted blanket, as there was a study that showed that putting a weighted blanket on your body during chemotherapy reduced anxiety while you're there receiving the therapy. We also encourage our patients to look into essential oils, and we have an essential oil therapist at the hospital as well to help us with this. So we encourage, getting an essential oil to bring with them prior, as well as all the different meditation apps. We encourage people to find a meditation app or music that they love to listen to while they come in for therapy, all the things to help reduce their anxiety while they're there.
Kaylee, did you have anything that you use in terms of mindfulness?
Yeah, certainly. Yeah, mindfulness can be super helpful. And just kind of as another note to what was just said. So there is a kind of a significant body of evidence in the research that it shows that psychosocial intervention specifically, so support, counseling support, mental health support, has been shown to improve treatment adherence. So along the same lines of what was just discussed around kind of that anxiety around anticipating chemo and kind of maybe not even wanting to avoid getting treatment. So in addition to kind of some of the other integrative therapies that we've been talking about, psychosocial oncology care definitely can have a significant impact in terms of helping to reduce that anxiety. And mindfulness, Maureen, as you said, is one of the primary tools that we use for that. And mindfulness is one of those things that kind of crosses over from mental health into complementary therapies and a lot of the other work that we do at the center. But yeah, things like meditation, deep breathing, grounding exercises can be really helpful. And a lot of times oncology social workers will be kind of integrated into the clinical setting and can even sit chairside in infusion and do some of those exercises during chemo, during infusions for people, which can be very helpful in the moment when someone may be experiencing that acute anxiety as they're getting treatment.
Thank you. We have another question. Is it safe to take herbs prescribed by an acupuncturist?
I guess I can take a stab at that. I think that's a place where it's always a good idea. Certainly if you're in treatment, I would love to hear Dr. Houle's response as well. there are herbs and supplements that can have an interaction with chemotherapy medication. So I think it's always wise to be sharing any of that information with your oncologist prior to using supplements.
Yeah, this is Dr. Houle. Absolutely. Some of the drugs cause the metabolism, or I should say some of the herbs cause the drug's metabolism to either increase or decrease, which can change efficacy, change side effect profiles. So we like to know about each herb that the person would like to try to use, and what's the purpose behind the herb. Sometimes, again, the herb is to maybe reduce anxiety, reduce nausea, reduce some of the symptoms from therapy, and that can be helpful. And if it doesn't interact, we usually encourage that. And just a brief comment back on one of the first questions about cannabis. We don't recommend cannabis as a direct, therapeutic, but we don't discourage it. And we will want to know about our patients using that type of herbal medication, if you will, because again, there's interactions. It interacts with narcotic analgesics. It can, have different effects when you combine it with some of the supportive medications. So that's where it's really important, again, to discuss with your oncologist exactly what you're taking and try not to hide anything. It's important for us to be very open with that discussion.
Thank you. We have a question from a caregiver. What integrative skills do you recommend for me?
In terms of caregivers, let's see. Maggie, how about we start with you?
Well, I was going to defer to Kaylee, but caregivers sometimes have the same types of stress as the oncology patient. Fear of the unknown, a lot of stress, worry, and anxiety, a lot of sleeplessness, a lot of just fatigue. So all of the complementary therapy services at the center address all of those things. So I would say that the care partners should explore what appeals to them and find someone that they can really connect to and have an open, honest conversation to set up a plan.
Kaylee?
Totally agree. I was going to say everything, everything at the Dempsey Center, any integrative support that's gonna feel good and feel helpful. Oftentimes caregivers have the added kind of stress or pressure of maybe not being able to feel like they can be open about what their needs are because they're putting someone else's needs first. But in reality, they're under an immense amount of stress, kind of having someone they love coping with a cancer diagnosis, and they're coping with it too, right? As the caregiver. At the Dempsey Center, we actually don't use the term caregiver. We use the term care partner because we feel it better represents the actual role. Someone who is a partner to the person that has the actual diagnosis and kind of walking through their cancer journey with them. Any service available to with the exception of acupuncture, any service available to a patient is also available to a care partner. And that's inclusive of oncology counseling. And we also have specific support groups available for care partners to address their needs specifically and to help them build community too. Because as I said before, kind of touching back to that point about isolation, being a care partner can feel very isolating as well. Having a community of others to kind of be able to feel validated and have your experience normalized can be really important.
Thank you. We have one other question here. Are there other mind, body, and spirit techniques that have been shown to work?
Maggie, did you want to talk a little bit about Reiki?
Sure. I'm not a Reiki practitioner, but we do have a Reiki program at the center. And for those of you who aren't familiar with it, it's a very, very gentle, sort of very light, hands-on approach. The client is fully clothed, lying on a massage table, and just the weight of the hands are brought to rest on different body parts, the shoulders, the feet, the head, the hands, the elbows, the knees. It can be very grounding and very settling. And I would say that for someone who's kind of unfamiliar with kind of the terminology of that practice, it can feel sort of like a kind of guided and focused body meditation. It's just a real chance for someone to really kind of tune into where they are at and to kind of just find some ease and peace. So I would say that would be one approach that might be worth checking out. It doesn't come with any of the contraindications that something like acupuncture or massage has. There are very few, very few precautions or concerns or worries for somebody to receive Reiki.
Great, thank you. Are these recommendations safe for kids? Not sure what recommendations, but
I guess that's what I was going to ask in terms of
therapies. Yeah, are the different therapies good for kids?
Maggie, go ahead.
Oh, I was just going to say we modify how we work with children. With children, we work for shorter periods of time with massage. For instance, we allow them to receive it in the way that's most comfortable for them. If it's sitting in a chair, if it's standing up, if it's while they're sitting there talking to their mom or dad. We have a therapy dog. So sometimes it's a little bit more impromptu. So we kind of meet kids where they're at. Yeah.
Great.
And just to clarify, many of the children that we happen to work with, we certainly work with kids who have a cancer diagnosis themselves, but many of the children that we work with in the film you heard Sarah talking a little bit about are kids who have someone in their life who's been diagnosed with cancer. So I'm not sure if the question was more about kids with cancer or kids in general. I know, Tish, you work specifically.
Yeah, we provide and actually work with one of the counselors, support for seedlings, which is we do a yoga class with our kids. But it is a support group in and of itself, but with play and yoga. So again, meeting our little ones where they're at, using movement and fitness.
Nice. Okay, and I think for our last question, we have, what are integrative medicine services covered by insurance?
Well, I can tackle that from a nutrition standpoint. It depends on the insurance plan. We in Maine, the dietitians get pretty good coverage from a number of different insurance plans. I would say that many of the folks that we work with are on Medicare, and that is not well covered. Nutrition is not well covered. You have to have a diagnosis of diabetes or kidney disease to get coverage through Medicare. So it would depend on the plan. But it can be fairly expensive. So we're pretty grateful that we're able to offer our services at no cost.
That's one of the things that's been a real benefit of the Dempsey Center is that we don't look at a person's insurance. We don't look at somebody's income. folks are able to access any of the services that we have at no cost to them. So we're very fortunate in this area to be able to provide that kind of care in that way.
That's really nice. That's awesome. Yes.
As far as from Torrance, because or just insurance not covering and cost being an issue, we really try to focus on a lot of different classes and videos. So we have a few different videos that have been put together from our dietitian on eating while on therapy and then eating after therapy in terms of regaining strength. Our OT, PT people are trying to make similar type of videos as well. So at least patients can access this information in a class setting or a video setting, if not one-on-one. We do also collaborate with Cedars on multiple different programs. So they have a sleeping class for help with insomnia. They have a class for chemo brain. So all these classes are free to our patients. So there's a lot of different resources there in terms of these integrative therapies, at least through a class and video setting.
Thank you, Susan. Well, I think we're probably running a little bit over time. I think it's about 11:15 there on the East Coast in Portland, Maine. So I'm sure you're eager to close out. We really, really want to thank you for participating with us on our annual survivorship event this evening. It's been wonderful to get to know all of you. I feel like watching you, it just was such a good connection and so nice to see what people are doing in other parts of the country and how they're taking care of the cancer population. It sounds like your center is extremely robust and comprehensive, from children to adults, and so many different therapies that you offer. It was inspiring and great to have you, and I hope we can collaborate on future programs for our cancer patients, and we'll look forward to participating on some of yours as well online now. That's very exciting. I want to especially thank you, Maureen. I know when we reached out to you, you were open-minded and said, hey, we would love to work with you. And because of your support, we are here tonight with you. So thank you very, very much for that. And I want to thank all of your wonderful, kind, warm, and caring and knowledgeable therapists, Trish, Caldwell, Judy Donnelly, Kaylee Sullivan, Sarah Walter, Maggie Miller, Liz Como, and Christy Demarco. You know, you can tell that you're there for the cancer patients and you do make a difference. So thank you for all the work you do. Thank you for the great information this evening. We really appreciate your support. And I also want to thank Dr. Houle for being here, our wonderful medical director who leads us and guides us. Susan Starr, wonderful nurse practitioner who sees patients constantly and is a big advocate on integrative therapy. Thank you for being here this evening. Alex Baker, who's back there making all of this happen. So amazing that we're doing a Zoom meeting with Maine, and we're here and we're all together. It's just amazing. Thank you, Alex, and your wonderful team. Julie Taylor and the marketing team here at Torrance, they are awesome and got the word out so that people could participate tonight. So we're very, very thankful for all of that support. And to Miriam, our survivorship coordinator, has put this together, another fabulous Cancer Survivors Day celebration for all of us. Miriam, we want to thank you for all your dedication and ongoing support over the years. And thank you for coordinating another wonderful event tonight. So thank you all for being here with us tonight. Have a relaxing evening.